Hey guys, Dr. Derry here again. So today I'm answering a question. So I often get asked this during plans of care when I'm treating patients and they're feeling better and their back pain is something that they've thought about but haven't necessarily had. And so they're like, okay, so what's the chances of this coming back? I've come to therapy, I've worked with you, I've gotten stronger and I'm feeling better, but what if this comes back? Well, unfortunately, there isn't a clear answer for that. And there's some evidence saying that if you keep up your strengthening and your healthy lifestyle, then the chances of it coming back are slim. There are some other pieces of literature that say, it really doesn't matter what you do. You're probably going to have some on and off low back pain. And I sit somewhere in the middle of that. I know, or we know, that 90% of individuals in their lifetime will experience some sort of low back pain. And so that's pain in their lower back that may radiate into their buttocks. It may be even further, or just having some discomfort and some feeling in the low back, whether that be before or after an activity or for any reason whatsoever. And so we know that back pain is something that everybody kind of works through or experiences. Now, what I've seen in the clinic is when you're feeling better and you're thinking about doing something, the chances of injury or pain happening is usually a result of load over time. And so if you ask your body to do too much too quickly, you may have an adverse response or discomfort. So what I tell people is, I make them ask themselves, what do you think would have happened if maybe you would have had some more range of motion or flexibility or even strength or resiliency and you attempted that activity? And so I think people, once they really think about that, they can understand that it's important to maintain their strength and resiliency so they can do the things that they want to do. And so in rehab, we often work on improving their strength and resiliency, but we also need to manage that load over time. And so when we work on someone's strength and they've had some pain, or maybe they're a little apprehensive about picking up a heavier weight, we flirt with that line because we need to expose that body to load or some sort of resistance so they can build that tissue strength and muscle strength. And so having a rehab professional on your side really take a look at your body and load you appropriately, so giving you the right amount of resistance at the right time, so you can do the things that you want to do and help prevent that low back pain from happening. And a lot of people know that they probably should do something along those lines, but taking the step and actually doing it is something that separates those from maybe having reoccurrent low back pain versus not having it. And so I wanted to answer that question. That is my typical answer, and that is something that I often come across in the clinic. But again, each response is specific to that individual, and really think about yourself and where you fall on that timeline. And I love talking about this, so I'm definitely going to bring this up in the future again. But the question is, will I have low back pain again? Probably. But it's what you do with it that matters, and what you know what matters. And so if we can predict it and manage it, we're in a way better spot than not predicting it and not being able to manage it. So take that tidbit of knowledge, apply it to what you can, and if you have any specific questions, feel free to reach out.